Pregnancy should be a time of joy and not anxiety for the woman and her family. Do you want to learn more about pregnancy or have questions about fertility and reproductive health? Then join Dr. Linda Vanotoo on Facebook and YouTube every Saturday at 4 p.m. on the online pregnancy school as she discusses pregnancy, delivery, and childcare with us.
Ladies and gentlemen, welcome to the second part of our discussion on the men. I hope you enjoyed the first one, and if you did not join us on the first session, please go ahead and look for it and listen to it because it will help us a lot. Like as I said, November we are looking at International Men's Day and focusing attention on men because they are very important. If we have a good family, we need to have the men to be healthy, and it should start from when they are young. So for me, the theme would be quality and optimal health for boys and men for better families, or good families, healthy families, anything that you want to say, but we need to get them to be of good health. So today I'm going to continue, but if you haven't done that yet, please go ahead and subscribe to the YouTube channel and also like our page and follow us on Facebook, The Pregnancy School. It's pregnancy school, but you know, pregnancy cannot just take place with the women alone. So we have to focus on the men as well. And I'm going to continue with the discussion. I've already told you about the health and wellness and some of the things that contribute to ill health in the men. Today, I'm going to continue and I want to look at some of the health challenges that can happen in men, so that if you are looking at yourself, you can now determine whether you have any of these and go to the hospital for appropriate assessment and treatment so you have a good health outcome. One of them is the heart problem. As we grow old, certain things go on in our bodies, and then we have the thickening of the vessels and the rest. So we can have some heart problems or what we call the cardiovascular diseases in men. We could also have diabetes, which is the blood in sugar as people call it. That could be some of the things that the men can suffer from. And then there's also the mental health issue. This I cannot stress enough because I told you in the earlier discussion that some people, even when they are depressed, the men, when they are depressed, instead of seeking help, they try to find other things to do so that they don't think about it, or people will not know that, yes, they are going through problems. But it's one of the things that has been found. And I told you that men are 3 times more likely to commit suicide than women, although women have more depression than men. And then there's also the issue to do with eye problem, then the liver problem. Liver problem could be because of different things, but for some of them it's because of alcohol intake. And I told you that when they are depressed, some of them resort to use of alcohol just to, you know, cover up or to mask the whole thing. So that can also happen. And then we have issues to do with the urinary tract, and then the sexual and reproductive health issues as well. These are some of the things that can happen to men. So you find that some people, as they grow older, they kind of start dribbling urine or something like that. It is, if you are a man and you are suffering that way, you are not the only one. So the best thing for you is to seek care. We will just run through some of these without going into detail, just to let you know that there are certain ill health that men can suffer as they go through life and as they grow older. Then we could also have the cancers in men. And for a man, you have a prostate, a woman doesn't have one. So that could be a place that you can have cancer. And interestingly, you know, some men have also had breast cancer before. Maybe you think that my breast is so flat, so it's not possible, but it could happen. So if you are there, you find anything wrong with your breast, though it is that flat, please do not stay at home. Go to the hospital and let it be checked. Then we have the issue of infertility and sexual problems. We'll be talking into detail about some of these things as we go along. But for today, I just want to let you know that there are all these health challenges that men can have. So if you are there and you haven't had any problem, thank God. But then also take care of yourself and take care so that anytime you have anything coming up which is not like the usual thing, you quickly go to the hospital for care. Now, another thing that can happen is that they can have poor nutrition. You know, some people, because of the work they do, they leave the house very early. They may not have time to eat properly. They eat anything that they get when they go to work. So that can affect their nutritional status. So they could be overweight or underweight, or they could have different things happening to them because of the nutritional status that they are in. Now, for some of them, they could also have infections. And in our part of the world, we have different types of diseases that are common. It could be TB, it could be syphilis, it could be gonorrhea, it could be HIV, it could be any other disease. So once you are there as a man and you find anything wrong from the normal state that you know, please remember that it could be a disease. And I told you earlier that they are known, they can be prevented, and they can be treated. So remember that do not stay with these diseases at home. Another thing that can happen to men is unintentional accidents. We know that by virtue of some of the work that people do, they can be climbing things, they can be using certain chemicals, they can be using certain tools. And unfortunately, some of them can get hurt from these things that they do. So that is not intentional. They didn't mean to harm themselves, but because of the work that they do, even at home, sometimes they have to do a certain kind of work, and that could also lead to accidents at home. And then one may wonder, financial challenges. You know, when somebody is financially challenged, it is not just about the money not being available, but it's about what the money could have done that now they cannot do. So that can also be a health challenge, because it will affect the person's behavior, it will affect the sleep, it will affect the way the person will eat, everything. So that could also be a problem for the man. Now, the other thing is how to balance home and work. It can be very challenging, especially if you don't have support. And for people who are outside of area where you don't have anybody supporting you, you have to take the child to school, go and pick the child up, join that with the work that you are doing. Maybe you don't have the permission to leave the work, or the work that you are doing, you cannot break somewhere in the middle. That could be a health challenge for you, because it would affect your attitude, it would affect everything. So as a man, this could be a problem for you. Now, another area that can be a challenge is for those who have adolescent children, how to handle them, how to relate, whether they are men, boys or girls, how to relate to them can also be a problem. And that can even give somebody sleepless nights. How do I handle this, my adolescent child, whether it's a boy or a girl? So that could also lead to some health challenges. And then, of course, relations with family and friends and with peers. For some people, before they got married, they had their own groups that they joined. Now that you are married, are you going to go there, or you are going to stay at home? If you go there, you have a problem at home. If you stay at home, you have a problem with your friends. So what are you going to do? That could give somebody a health challenge, you know. And if it is not well handled, that could bring problem to the relationship, either the home or with the friends. So that is another thing. And for a lot of the men, because of what I said earlier about men having been tagged as strong people who have to be strong both inside and outside, if somebody goes through a challenge and the person is not able to handle it properly, that can create an internal problem that can express itself outside. So you can have somebody who unfortunately is going through a situation that has been internalized, and the person is not able to handle it inside, and that can break this person down. And one of the other things is, if you have something that you want to achieve, but you have not been able to do that, and you assess yourself, what have I been able to do? Maybe I'm 40 years, I haven't been able to do A or B or C. I was hoping that by this time I would have done this thing or done that thing or gone here or gone there. If that is the way you are looking at yourself, that can be a health challenge for you, because it will not just end with not being able to achieve that, but it will be linked to other things: not sleeping well, not eating well, being angry with everybody. That will be a health challenge for you. So that is another area which somebody may not be looking at, but whatever you have set for yourself to do, it's important that you plan for it so that it doesn't create health problems for you. And that's why I'm talking to the young people as well, because if you are growing every day, you have something you want to do and you haven't planned for it, you get to a stage where you may think that now I cannot even do it, and that can create problems for you. And then for other men, they have health problems because of the expectation from others, not themselves. I've just spoken about you having an expectation for yourself and not being able to achieve it by a certain age. But for others, it is because of other people's expectations. It could be family members, it could be other people. For example, they may think that at the age of maybe 30, you would have already married a nice lady and you would have had 1 or 2 children. If at that time you don't have a wife, you don't have any children, that could be a problem. It's not just the women who have challenges if they are at a certain age and they are not married. Even the men can also have those challenges. So that can create problems for you. Or you were hoping that by a certain age you would have built a house and you haven't done it. That could be a problem for you. So from all these that we have mentioned, ladies and gentlemen, there are some of them that are top. And these are things that we have to look out for in men. I'm talking to men, but if you are there as a woman, you have your son, you have your husband, you have your brother, it is important to also support them to access health, because if they are healthy, it will be good for the whole family. So some of them that are very important are out of the lot. All of them are important, but some of them are quite common in men. And those are the heart diseases, which can lead to stroke. And then we have the cancers of the lung, the prostate. Then we have the depression and suicide, diabetes, and erectile dysfunction. Erectile dysfunction will go into detail later, but it is one thing that affects a lot of men. And unfortunately, they do their own self-treatment, and that can even worsen the situation. So it's an area that you would want to seek proper health care. Please do not on your own do that, because it's one of the most common things that happen to men. And then the other one is to do with the urinary incontinence, which means that you cannot hold urine. You find sometimes you dribble urine, and that can be very embarrassing if you are in town, because if your pants is like that, you can see any fluid or water that is in it. Then when you go somewhere and you urinate and you have that will be a problem for you. Ladies and gentlemen, today I'm continuing with the discussion for men. And if you have just joined us, this is still the online pregnancy school, and I'm Dr. Linda Vanotoo. And today I'm talking about men because November we have the International Men's Day, and we need the men to be healthy for the women to be pregnant, and also to have healthy and good families. Now, generally, to be able to prevent disease, for us, the men listening to us now, the men listening to me now, you must maintain a healthy diet. I said that for some people it's very difficult because they go to work. So you have to maintain a healthy diet, and also that will lead you to have an optimal weight. And in order not to do it the wrong way, it will be good to seek the appropriate help to do this. I know some people who determined to lose weight by themselves and they did it the wrong way, then they became anemic, and that is another issue altogether. So please do it the wrong way. And also it will be good to have simple but regular exercises. I know it is difficult. For some of us, our works are such that we may not have time to do this. But in some instances, it's said that if you are going to the second floor, for example, instead of taking the lift, go on the staircase. When you are coming down, walk on the staircase. If you're in the office, you need to get something. Do not just sit on your chair and wheel your chair to where that thing is. Get up and walk. And if you need something from the next office, if you are still going to the office physically, get up and go to that office and get it instead of getting a phone and calling somebody to bring it. Just find ways of being a little active. And in the morning, you can just walk through your own home. Just take a few steps within the house. If there are staircases there, you can go up and down. So find innovative ways of being a little active. And you can just be lifting your hands and doing that, or throwing your legs, something that will make you more active. But if you have the means and you have the time, you can also join a group that does some physical exercises, or you get yourself some things that you can use at home to do your own exercises, or walk in your compound. Anything that you can do to let you be a little more active on a regular basis, that will be good. And also, it's very important to have a good sleep, especially in the night. I know that for a lot of men that I have spoken to, they have challenges sleeping at night. Some of them wake up as early as 2 a.m., though they slept late, and they cannot sleep again. And we may talk about sleep one of our sessions, but please try and go to bed at the same time, and also do not go now to bed and start flipping through your phone. Try and create the environment for you to sleep. We can talk about sleep later. And drink enough water. A lot of people do not drink water. They only drink when they feel thirsty. You should make it a point to be drinking water on regular basis so that you hydrate your body, because it's very important to keep yourself hydrated. Then you can pass urine as you speak, as you sweat. It takes some water out of your body so that you don't become dehydrated. And then also maintain healthy relationships. As men, please maintain healthy relationships. Have people that you can trust. Have people that you can talk to. They could be your wives, your children, your family members, your pastor, anybody, somebody at work, somebody that you can easily go to if you think that something is overwhelming you. So please maintain those healthy relationships. And then one key thing, appreciate yourself. Some people look at the negatives that they have without appreciating the positive. Everybody has something that is good. So appreciate yourself and have regular medical checkups. I don't know how often you do that, but try and have regular medical checkups. If it happens that your office has that in place, then you are blessed. If you do not have that, or you are working for yourself, please find a way of adding that to your yearly things that you do, so that you can have regular medical checkups. And then for me, I would also say that know God for yourself as an individual. Have a personal relationship with God, because it is very important. If you cannot talk to physical people, at least you can talk to God. So have that at the back of your mind, that I'm going to have this relationship with God, and every day I'm going to talk to him, and he will help you, he will guide you, and that would also help you to know where to share your story if you have to go anywhere. We will be talking about different topics as we go along, and we'll let you know of some of the activities that we have planned for you. But it's important. And if you are looking for somewhere that you can register to have your medical checkups, please, you can link up with me. Just send me a WhatsApp message, +233 59 242 0625. If you are in Ghana, you don't have to add the +233. Just start with 059 242 0625, because there's a lot that can be done for you to ensure that you have regular checkups, because there are many benefits to having regular checkups. And some of them are that you reduce your risk of getting sick. If you go to the hospital, they check and find that your blood pressure is going up. Immediately, they will start treatment so that you don't go on to develop the complications of hypertension. Or if they find that your sugar is high, if they find that there's something that has to be done for you to prevent some of these things from happening, then of course it will be done. And then it also increases your access to treatment and early care. So if you go for medical screening, they find something wrong, treatment is started early, health promotion is started early, and then that will help to have a good life. And of course, that will limit the risk of complications. And also it promotes early referral. You may be in a place where the best care that you need is not in that particular health facility. But if you go early, then you can be referred early to another place where they can check everything out and make sure that you get the best care that you need. And if you have medical screening or medical checkups on regular basis, it also helps you to adjust your plans. For example, if it is found that you have a particular condition, and that means that you shouldn't do A or B, it helps you to reorganize yourself to know how to manage your plan such that you will not have that disturbing you. Or if you have to travel, you know that whilst I'm traveling, these are the things I need to do, or they can even give you a referral to wherever you are going. So when you go to the hospital, they are not now going to ask for all the details which you may not be able to give, but they'll give you what you need to travel with. So it is very important that you give yourself that treat of having medical checkup. It is very, very, very important for the men. I'm talking to the men, please. Today I'm looking at what the men can do to stay healthy for themselves and also for their families. And once you do that, you'll be helping that young boy as well. And as we look at going through these medical screenings and medical checkups, treatment and the rest, one of the things it does is that it will help to increase your lifespan and the quality of life that you have. Because once treatment is given, we are sure that it will help you. And if you need to have anything done for you to psychologically be at peace, it would also be done. And over time, it reduces your healthcare costs, especially if you do not have health insurance covering whatever area you are in. If you have the regular medical screening or medical checkups and you are found to need a certain kind of intervention, it is done early, so you don't have to spend more money to treat the complications. Please, I'm talking to men. And then it also helps you to form a good relationship with the healthcare providers. We are not praying that people should be sick, but if you know the healthcare provider, if you know the doctor, you know the nurse, or you know somebody else, you can call if you're at home and anything happens, especially where we are, where we don't have the system that exists in different places where you can just call the ambulance for them to come. It is good that you have that relationship so you can call somebody. And it will also help you to get updated information on things that are happening. These days we have the internet. A lot of things are happening. People come out with all sorts of things. So it is very important that you get yourself informed from the right source. Because if you just read anything and you don't know whether that has been validated or not, you may be tempted to try something that will not be good for you. So if you get in touch with the hospital through your regular medical screening, you know them. And if there's anything new, they will let you know. When you come, they can tell you. Then it also saves costs, which you can apply to other areas of the family's life. Because if you save yourself from developing complications, you will not spend that money. You can spend it at home to do other things. And remember that we are linking this to your own self-assessment and where you would have wished to be. If you are somewhere that you want money to do something, invest in some business or anything, and you find that now I'm sick, I have to take it to the hospital, then you wouldn't have achieved that. And you remember that that was one of the health challenges, something that can give you a health problem. So this will compound it. So if you're able to prevent that by going for regular medical screening, then you have saved yourself some money and you can put this into something that you wanted to do. Ladies and gentlemen, this is the online pregnancy school. Yes, it is the online pregnancy school, but today we are talking about men. We need them to be healthy so that the family would also be healthy. And when you are able to go through the medical screening and you have all that done, then you'll be helping to build a healthy nation. because the men are very important. They lead in a lot of the ways. They lead in a lot of the institutions. They lead in most of the families. They lead in very, very big organizations. So if we are able to keep the men healthy, then there will be a lot of development going on. I hope you've learned a lot for yourself as a man. And if you are a woman listening to me, please share with your brother, your friend, your husband, your uncle, your father, anybody who is a male that you know. Please share with that person because it is very, very important. So, ladies and gentlemen, today I continued from where I left off the last time, talking about male health and the need for us to focus on men. We have had programs for women and children and left out the men. That is why Promise Initiative is looking at the men, and it is important. I cannot overemphasize this, that it is very important that we pay attention to boys and men, the adults also. So from the last presentation up to now, we have spoken about wellness as a means of getting to good health. The two must go together, because you may have been born with a particular disease or diagnosed with a particular disease, but then if you follow some principles, you will still be healthy. So that is very important. And then we also want to say that please make use of available health and other resources for you to be able to enjoy good health and maintain your wellness. It is key. And if you will be able to do this, it means you have to avail yourself of the services that are available. And being healthy means that you have to keep active. You have to be confident. You have to be productive, because if you are healthy, you can do a lot of the things that you do. And it also helps you to maintain healthy relationships. If you are healthy, you don't have those challenges of thinking about spending money here or spending money there. You have better relationships. And then it also helps you to create wealth. We have to be healthy to create wealth. There are people who have made money, but they have spent almost all of it on their health. But if you keep yourself healthy from the beginning, you make the money, you use it to make more health. And you plan for your health. It means that anytime you need to go to the hospital, you need to have a screening, you need to have any test done, you already have it. That will shorten the time that you are unhealthy and unable to work. So you are able to create more wealth if you are healthy. And then it also decreases your chance of getting other diseases, because sometimes one disease can lead to another or coexist. So if you are able to do that, then of course you become healthier and you stay well. Well, ladies and gentlemen, although male health has not been prioritized as the health of women and children, we can start as individuals to draw attention to the need for health for boys and girls to also be prioritized. And this is what I have done with you. I hope that you'll be concerned about your health and therefore take good care of your health as we go through life. Well, this is where I end the discussion on the male health. As I told you, there are some of them that will take us individuals and go into detail to address them. But remember that this is still the online pregnancy school, and pregnancy should be a time of joy and not anxiety or fear. Please share with friends and family. And if you haven't done that, go ahead and hit that subscribe button. Turn on that notification bell. You will not miss any of the sessions we bring your way. And for those who have been following us on Facebook, we say a very big thank you. Continue to do that. Share with friends and family. And let me hear back from you. Send me comments in the comment section. And also buy yourself a copy of the magazine, Promise from the Womb. Once again, my name is Dr. Linda Vanotoo, and it is always a pleasure coming your way with the online pregnancy school. See you in my next video. Bye.
Pregnancy should be a time of joy and not anxiety for the woman and her family. Do you want to learn more about pregnancy or have questions about fertility and reproductive health? Then join Dr. Linda Vanotoo on Facebook and YouTube every Saturday at 4 p.m. on the online pregnancy school as she discusses pregnancy, delivery, and childcare with us.